What is duloxetine? Duloxetine is a prescription medicine. The brand name is Cymbalta. Cymbalta belongs to a class of medicines known as SNRIs, or serotonin-norepinephrine reuptake inhibitors. What is it used for? It is used for a variety of reasons, including to treat depression and anxiety. It can also be used to treat painful nerve conditions and diabetic nerve problems. It can be also used to treat fibromyalgia and chronic musculoskeletal problems such as muscle and joint pain. Duloxetine can be used off-label to treat stress urinary incontinence. How to take duloxetine? You can take this medication by mouth, with or without food, as directed by your doctor. This medication is usually taken once a day unless there's a specific indication like stress incontinence or for the treatment of major depressive disorder, and your doctor would then put you on this medication at least twice daily. What dose should you start at? Well, this would depend on a number of factors, including your age, your medical history, and what other drugs you're on. I typically start patients on lower doses, which are 20 milligrams or 30 milligrams, and titrate the dose up weekly, monitoring for tolerability and side effects. The dose has to be adjusted if you have renal impairment and if your creatinine clearance is less than 30. In older adults above the age of 65 for major depressive disorder, I would recommend you starting at a dose of around 20 milligrams daily, and for generalized anxiety disorder, 30 milligrams daily. Duloxetine side effects. 16 tips and advice to minimize or avoid these side effects. Number 1, there is a black box warning of increased risk of suicidal thoughts and behavior, especially in children, adolescents, and young adults. If you do have these thoughts, immediately reach out to your doctor or your healthcare professional so that you can be helped and be taken care of. Number 2, this medication can cause liver problems. The main symptoms would be nausea and vomiting, abdominal pain, yellowing of your skin and the white of your eyes, and dark colored urine. Your doctor should check your liver parameters regularly. Number 3, another side effect would be orthostatic hypotension. That means if you stand up too quickly, you might get dizzy, lightheaded, and fall. When getting up from a sitting position, take your time. Be cautious when you're going up or down the stairs. Number 4, this medication may increase serotonin and rarely cause a very serious condition called Serotonin Syndrome. You might be taking other medications that can interact with duloxetine, causing high levels of the chemical serotonin to accumulate in your body. This can result in a variety of symptoms such as high fever, muscle twitching, fast heartbeat, hallucinations, loss of coordination, dizziness, GI symptoms such as severe nausea, vomiting, and diarrhea, and also unusual agitation. It is important that you speak to your doctor about what medications and supplements you are on to minimize any drug-drug interactions. If you are interested in what drugs might cause serotonin syndrome and potential drug-drug interactions, check this video where I explained it with the drug Lexapro. Number 5, this medication can also cause an increased chance of bleeding, so talk to your doctor before a surgical procedure. He might want to hold or stop the medication. Number 6, if you are above 65, as the side effect profile is dose dependent, your doctor will increase and titrate the medication slowly. Do not start at a higher dose or increase the dose too quickly. Number 7, do not suddenly stop the medication, as it can cause something called discontinuation syndrome. You might have severe nausea, dizziness, and electric shock-like sensations in your head called brain shivers. Some people feel so unwell they're unable to work, and in some situations you might be needed to be treated symptomatically at the hospital. Number 8, side effects also include skin reactions such as contact dermatitis, bruising, rash, itching, night sweats, and skin photosensitivity. Discuss with your doctor the options such as decreasing the dose or treating the skin condition symptomatically. Rarely you might be faced with a life-threatening skin condition called Stevens-Johnson syndrome as a side effect. Number 9, the medication can lower your sodium. This is called hyponatremia. If the sodium is too low, this can increase the chance of a seizure. Your doctor will have to check your electrolytes periodically with a blood draw. This medication can also cause acute close-angle glaucoma, which can be an ophthalmological emergency. The symptoms include eye pain, changes in vision, swelling and redness, which can rapidly lead to permanent blindness if you're not treated in time. Make sure you follow up with your eye doctor regularly. Symptoms include abnormal orgasm, erectile dysfunction, and decreased libido. You might want to discuss the dose with your doctor as well as consider the timing of the medication. Number 12, duloxetine may activate a manic episode, especially if your depression is not unipolar depression and rather bipolar depression. Make sure when you're having the discussion with your doctor that you are as honest and transparent with all your symptoms. A family history, younger patients, as well as a history of depression with psychotic features are considered risk factors for this condition. Number 13, duloxetine can increase your blood pressure. Check your blood pressure regularly at your doctor's. Number 14, although the drug is used to help with stress incontinence, post-marketing surveys have found a rare association with urinary retention. If you do have trouble urinating, alert your doctor about this. Number 15, do not take this medication with alcohol. It's not a good idea. Number 16, duloxetine can slightly increase your blood sugars. So if you're diabetic, make sure you're monitoring your blood sugars closely. And if you're interested in the side effects of another common antidepressant, click right here for a video. And if you want to see more videos, you can click right here, or click right here, or here, or here. Have a good day and think your health. I can't say this. This is like a barrage of tongue twisters. It's not that hard. And think your health. Okay, I'm done. I've got a stomachache now.